Hello and welcome to today's webinar, Implementing the GI Map in Clinical Practice. Today's presenter is Dr. Dan Kalish. Dr. Kalish, IFMCP, is founder of the Kalish Institute, an online practice implementation training program dedicated to building integrative and functional medicine practices through clinical and business courses. Since 2006, the Kalish Institute has helped develop practice models for over 1,000 practitioners worldwide. Graduates of the Kalish Institute include practitioners ranging from the Director of Integrative Medicine at Mayo Clinic to Cleveland Clinic functional medicine physicians. In 2017, Dr. Kalish became lead faculty for the Institute for Functional Medicine's Practice Implementation Program. He also began a strategic collaboration with the Institute for Functional Medicine through co-development of a new course, My Practice Plan. The course curriculum focuses on the development of business models for those entering the field of functional medicine. So Dr. Kalish, take it away, and there will be a Q&A after the presentation.
All right, thank you so much for hosting this. I'm super excited. It's a new talk that I want to present, explaining how to interpret and work with the GI map. And let's just jump right into it. So the fundamental concept of functional medicine, the guiding principle is that GI dysfunction is very common and can trigger just about anything from an autoimmune illness to chronic fatigue to depression to neurological problems to metabolic disorders and to thyroid problems and so on. And so if you believe that and you believe that you're doing functional medicine, then why do we all just run GI tests only on patients who have symptomatic expressions of GI problems? It makes no sense. And I know that we all do this because I did this for many, many years. And when I travel around the country and I give talks, I'll ask people to put their hands up and say, how many of you believe that health begins in the gut, and that you need to really understand the fundamental concept of whether your patient's gut is healthy or not for any case, whether it's neurological, whether it's autoimmune, whether it's a hormone case, whatever. And everybody always puts their hand up. But then when I ask the question, how many of you run a GI test on every new patient as part of a basic functional medicine workup, there's always like 2 people out of 50 that put their hands up. So that's just one thing I want to start out with, is that if we believe that the gut is responsible for all these problems, that the microbiome matters, you have to run a GI test on every new patient. It makes absolutely no difference whether they're having GI symptoms or not, because we're not symptomatically oriented. We're looking for underlying root cause, right? And so then when we get to the treatment options, it's just overwhelming. And here I just listed off all the things that we were supposed to know how to use: prebiotics, probiotics, fiber, enzymes, gallbladder support, leaky gut repair, GI immune boosting, anti-parasitic, bacterial, and yeast programs. So there's this overwhelming confluence of stuff that we're supposed to know how to use. And then we have these really complicated labs. And it's very difficult in those first couple, 3 years of being in practice to put all this together. And so what I want to help you with today is give you a structure so you can personalize the treatments for each individual program that you design based on a simple to interpret 3-stage system, so that you're not completely overwhelmed. And as the years roll by, if you want to make your life more complicated and do more complicated stuff, then it's fine. But this is a great starting point. I think you'll find also that a lot of the senior functional medicine doctors end up coming right back to the starting point. I'll describe that a little bit more in detail in a minute, okay? So what are the 3 stages that you want to look at? When you see a lab, like we're about to look at these examples, you want to identify, is this person in a stage 1, 2, or 3, or all 3? Stage 1 is there's a microbiome imbalance. Something about the microbiome has gotten thrown off. A stage 2 means that the GI organs now are not working very well. Which GI organs? Pancreas, gallbladder, intestinal tract, etc. And then stage 3 implies that there's GI pathogens present. And these are progressive, right? These go from one to the next. So in other words, if you have a stage 1 for a really long time because you're stressed out of your mind, you're not eating very well, your adrenals are getting weak, your secretory IgA is kind of falling apart, lots of bad things are happening, then the microbiome starts to collapse, right? We're not eating the fiber that we need, we're not eating the polyphenols that we need, and eventually the microbiome is going to start to collapse. So that's the beginning for most of our patients of these GI problems. And you can notice that they're oftentimes lifestyle driven, right? Stress, poor diet. If that goes on for long enough, then you can become a stage 2. Now the GI organs aren't working very well either. Now you're so stressed, your stomach's not working properly and not making enough hydrochloric acid. Now you're so stressed, your pancreatic enzymes and your bile production are not doing what they should. Now you're so stressed and inflamed, right, that the gut starts to become leaky and secretory IgA levels get all wonky because you're getting further and further down this path of GI-related problems or health problems in general. And then eventually, if stage 1 and stage 2 go on for long enough, we become weakened in our immune response. It's easy to pick up a pathogen. Then we get parasites, bacteria, or yeast overgrowth. And this is where we find a majority of the patients that we're working with, is that they have either a stage 1, a stage 2, or stage 3, or very often all 3 of these things running. And we want to figure out from the labs how we're going to treat that, right? So this is a progressive process. It gets worse over time. Now, if we can glance at one of these labs and in 5 or 10 minutes come to a general understanding of what stage that person is in, then you're going to be able to design supplement programs and deal with the what do you call it, like patient communication interactive portion of the experience, because people aren't looking to just talk to a doctor and get some algorithm generated kind of auto report thing. They want to interact with a human being who's compassionate, who can explain what's going on, make them feel comfortable with their health issues, and then outline a treatment program that's going to be effective, right? So this is not exactly rocket science when you boil it down to these 3 different stages. And the first stage is, are the normal bacteria in balance or out of balance? How is the microbiome doing? And fortunately, we have these beautiful labs to show us that. The second stage is that look at the GI organ markers. Is there GI organ dysfunction? Okay, and so you're going to want to treat that, right? The pancreas, the gallbladder, the intestinal tract, you need to deal with the organs. Or in the third phase here, is there something you need to kill? Is there something bad, parasite, bacteria, yeast overgrowth, that you're going to need to eradicate? What's going on with that, all right? And so for stage 1, we have this commensal or normal bacteria or normal flora section. And it is riddled with these names that most of us, are not so familiar with, although I have practiced. And one of the first things that my teacher did, I have a microbiome teacher that I work with every week, and one of the first things he did is he made me learn how to say these things. He's like, Dan, you're going to have to learn how to pronounce these things if you're going to do lectures. And so he would it was like being in French class when you were in, like 7th grade. He would be like, Akkermansia, and I'd be like, Akkermansia? Akkermansia, mucinophilia, Faeculobacterium protsnutzi. I can say all these names now. I suggest you learn how to say at least 5 or 6 of these, so you can talk intelligently to patients about what's going on. But what we're really looking for behind the scenes here is there a normal set of commensal bacteria, or are there lows and highs? And you don't necessarily treat an individual one of these organisms, right? That's kind of not how it works, a little more complicated than that. But what you're looking for is a balance within all these organisms. And so if these markers are off and you have a series of lows or highs, you know that the microbiome is out of balance by definition, and there's a problem there, okay? So right off the bat, this person's a stage 1. If there's a microbiome imbalance, that would be probably where the problem first started, right? Whether it was stress or poor diet or whatever it may have been. And so now you're already automatically, right off the bat, you've got a whole bunch of things that you can do treatment-wise, okay? And right off the bat, you can use fiber to bring these good bacteria back, because many of these bacteria, fiber is their food supply. You can use prebiotics, of course, and prebiotics, again, imply this is the food supply for the good bacteria. It's how you balance the microbiome. And there's some special prebiotics called polyphenols, which are incredibly powerful in terms of getting these good bacteria to balance out. And then, of course, you can use probiotics as appropriate. So right off the bat, you have 3 simple treatment options: fiber, prebiotics, including polyphenols, and probiotics that you can use to reestablish a healthy microbiome. And that would be treating the stage 1, right? That's the very first thing you could potentially do. Now, if you want to up the ante a little bit and the patient has some more problems, you might think that they have a stage 2. And now we're looking at the organs that are involved. Now, it's not just the microbiome, not just the bacteria that are out of balance, but now that person's gallbladder or pancreas or intestinal tract is not working properly. And that's going to result in poor digestion and malabsorption. If you can't make enough bile or pancreatic enzymes, then you're going to have all kinds of horrific problems with breaking down your food. And if your immune system is damaged in the intestinal tract, and if you have a leaky gut, if your gut is inflamed, you're going to have a lot of problems with digesting food. And if, again, we're kind of believing that the gut is the source of so many different health problems, you may see stage 2 with gallbladder, pancreas, and intestinal inflammation on an autoimmune case. You may see it on a chronic pain case. You may see it on someone that simply is trying to get pregnant and has a hormone imbalance. And then how do we find these? Pretty easy. It's right here on the test. So steatocrit, out of balance, is a gallbladder problem. Now you know there's organ involvement. Elastase, if it's out of balance, relates to pancreatic enzymes. Now you know that you have an organ involvement. Secretory IgA, out of balance, lets you know right away that the intestinal tract is suffering. Inflammation, like calprotectin, automatically lets you know that there's a problem with the intestinal tract. So these markers here under intestinal health will let you know if there's organ involvement. Again, steatocrit for gallbladder, elastase for pancreas, secretory IgA, calprotectin let you know about the intestinal tract lining. So easy way to find if these are stage 2 markers. So what would you do when you first get one of these tests? You look at the commensal bacteria, the normal bacteria. How's that microbiome? Doesn't look so good. You then look at these markers here. You're like, how's the organ system doing? Oh, that doesn't look really good either. Okay, now you're off and running to determining what you actually might want to treat. For stage 1, we mentioned fiber, polyphenols, probiotics, prebiotics. For stage 2, pretty straightforward, depending on what marker is high. If steatocrit is out of balance, then you're going to give gallbladder support. Most of the gallbladder support, different companies we have some oxblow on it, have beet leaf, there's some classic sort of gallbladder formulas out there. And then if the elastase marker is off, you're going to give pancreatic enzymes. And I'd say in the last, like 5-6 years, the one thing I've really come to appreciate that I think I underappreciated for the previous 20 years was how important the gallbladder is. So your gallbladder is doing a lot of different things, and if you're not making enough bile, you're going to have massive overgrowth of bacteria in a bad way in the small intestine. So these can be really powerful treatments, correcting the gallbladder issues, correcting the pancreatic enzyme issues. And in fact, they can reverse, complex situations like SIBO even in some of your patients, right? Then the second part of the stage 2, you've looked at the pancreas, you've looked at the gallbladder, now you're starting to think, okay, how's the intestinal tract itself? And if secretory IgA is out of balance, we're thinking there's a problem with the immune response in the intestine. If calprotectin is out of range, you know that the gut is inflamed in terms of the intestinal tract. So now again, you're seeing, okay, there's actually organ involvement. This person we're gonna need to address that, right? And in terms of treatment, steatocrit, gallbladder support, elastase, pancreatic support, secretory IgA, calprotectin, zonulin, those kind of markers, you're going to do a full-on leaky gut repair and anti-inflammatory program. Okay. Now, let's say that they've had a messed up microbiome for a while, their GI organs have not been working for a while, their gallbladder is not working, their pancreas is not working, their intestine is inflamed. Not a big surprise that they would eventually become what I call a stage 3. Now they have serious problems, right? Now they have GI pathogens. So the infections of the GI tract are coming about because of the weakened microbiome and the organ dysfunction. But if they're there, you may need to deal with them. Once these infections are acquired, oftentimes we have to address them directly, and that could be parasites, bacteria, or yeast. I try to always say them in that order because that's the order in which I typically would recommend that doctors treat them. So if you see more than one infection, and you typically want to treat parasites first, then bacteria, then yeast towards the end. Of course, there's many exceptions to that, but that's sort of a general rule of thumb. So then how do you find whether they have parasites or not? They make it pretty easy because they put big red marks on this when there's abnormal. So it shouldn't be too hard to see. Do they have blasto, endolimex nana, dianthomeba fragilis, all these different kinds of infections that we see in our patients all the time. So that would be for parasites. And then you can also have bacteria. Now this gets confusing right off the bat because we've already talked about the commensal or good bacteria. Now we're talking about potentially harmful bacteria. And then some of these bacteria like H. pylori can switch back and forth, right? So H. pylori for some people can be protective, for other people harmful. In general, I find for most patients that are sick, we're going to want to treat H. pylori if you find it. Okay, so this would be a bad thing that you'd want to get rid of if you see an H. pylori that's positive. The other bacteria to be on the lookout for would be C. diff, and that often needs to be treated as well, pretty much always. And then to make things a little more confusing, there can also be just a general bacterial dysbiosis. So these are not pathogens that are disease-causing to the extent that they're life-threatening. But if you have enough of these opportunistic or potential autoimmune bacteria, you can have a really serious health crisis on your hands, and that person might be completely flared up and have all kinds of symptoms that are directly coming from their gut because of these kind of bacteria. So the bacterial groups again would be H. pylori, C. difficile, these are all the bad ones. And then these dysbiosis markers, cumulatively taken together, you may want to treat dysbiosis. And then the last category after parasites, bacteria, would be yeast. And this lab has a really remarkable view of yeast overgrowth. They look at Candida albicans, Geotrichum, Microsporidium, a whole bunch of different yeast organisms are detected. And again, if they have a yeast overgrowth, you just need to make the clinical decision, are you want to treat the yeast or not, okay? So for this stage 3 level, do they have parasites? In which case, are you going to want to use an anti-microbial herbal program? Probably. In some cases, medications, maybe, if there's some really extreme reason why a person may need a prescription, that can happen sometimes. And then with the bacteria, H. pylori, C. diff, or the dysbiosis, the bad overgrowth of the bad bacteria, you have specific treatments, right? So H. pylori, I've always used a mastica product. All the companies will have a product with mastica in it. Just want to dose it pretty high so you get to a therapeutic level. C. diff, usually we try to clear that with Espulardi, and we're assuming under all this that they've already gone through a basic medical workup, right? If they have C. difficile and they have a lot of blood in their stool or something like that, they should be in the emergency room or urgent care. But we're assuming that you've already screened and you've ruled out any major GI problem in terms of a medical issue, right? We're just talking about the natural treatments today. And then for the dysbiosis treatments, again, anti-microbial herbal programs. Yeast overgrowth, anti-yeast herbal programs as well. Sometimes people use drugs like diflucan or nystatin. I usually prefer that people start with the herbs and see if that's going to work or not. Okay, so then a summary of the 3 different stages. We've got stage 1, the imbalanced normal bacteria, right? These are the commensal good bacteria, but they're out of balance, so there's a problem with the microbiome. Stage 2, there's digestive organ issues, the pancreas, the gallbladder, the intestinal tract, something's not working in terms of an organ. And then stage 3, there's some kind of bug that you gotta kill, whether it's parasite, bacteria, or yeast. And so the treatments, again, for each one of these are pretty straightforward. For stage 1 with a microbiome problem, you want to restore the health of the microbiome. And of course, prebiotics would help do that. Polyphenols, kind of lumped in there with prebiotics by kind of separate call out there because they're so special. And then probiotics and fiber. So let's talk a little bit about each one of those. So for prebiotics, there's all kinds of different versions of this. All the companies will have these. They're almost always in a powder form because it's hard to get enough of them crammed into a capsule. So you usually give a scoop or 2 once or twice a day of one of these various powders, and it'll start to get the good bacteria to balance out. Oftentimes these powders also have some anti-inflammatories in them as well, but more and more things are going towards prebiotics. There's more and more prebiotic products coming on the market now, just in the last year or 2. And then for polyphenols, we're talking about the things like, what do you think about polyphenols? Like classically blueberries, or you think about green tea, right? Where you think of these molecules, these polyphenol molecules are large, and we usually think of them as having these really powerful antioxidant, anti-inflammatory functions, which they do, but they're also the food supply for the good bacteria. So most of the polyphenols that we consume in the food supply, and most of the ones that we take from supplements, are molecularly large structures which cannot get into your intestinal tract. They can't get across your intestinal tract into your bloodstream, right? Obviously, sorry, they get into your intestinal tract when you chew them and eat them, but they can't get absorbed into your bloodstream because they're so large. And those polyphenols are actually a food supply for the good bacteria. The classic one you read about all the time is cranberry helps with Akkermansia and mucinophilia, and there's all kinds of research on cranberry. Pomegranate's pretty good too. So are blueberries, right? Anything, so is green tea. Anything that has polyphenols in it is going to encourage the growth of the good bacteria because that's a food supply. And then, of course, probiotics kind of go without saying. That's sort of obvious, right? If you're not having enough good bacteria, you might want to use probiotics. And then fiber is kind of a sleeper. I don't know, like fiber is sort of underappreciated because the right kind of fiber, as long as a person digests it well, is going to, again, not be absorbed by the human body, but provide a substrate or a growth medium for the good bacteria to break down. So the good bacteria break down fiber from our food or from supplements, if we're using supplements, and they turn that fiber into fat, which sounds insane, but it's what happens, right? They turn these organisms, they use the fiber for energy, and they spit out as a byproduct of that energy, their waste product are what we call short chain fatty acids. And these fats, these short chain fatty acids, okay, they're short fats, but they're still fats, right? They make up like 70+% of the energy supply for the enterocytes. So this is the major energy supply for the entire digestive tract is coming from the short chain fatty acids, is coming from the fats that are made by the bacteria that are breaking down fiber. So you can use fiber in a supplement form to indirectly get the good bacteria to grow better, which will then in turn give the fuel supply that the intestinal cells need to function properly. The most famous one of those is butyrate, there's propionate, there's a whole bunch of these short chain fatty acids that are a result of fiber. So of course, when you're designing a supplement program, you can use 1, 2, or all 3 or 4 of these items if you want to get the microbiome back on track. Stage 2, very straightforward. If you see enzyme-related problems, you give enzymes. If you see a gallbladder problem with steatocrit, you're going to give gallbladder support. And remember, gallbladder is extra important. It does a lot more than one would think. If you have some of the leaky gut markers or inflammatory markers, then you're going to work on the powders, et cetera, that start to control for intestinal damage and start to reduce that. Okay? And then if they have a stage 3 and there's a bunch of organisms running around that are bad, then you may want to do some anti-parasitic, antibacterial, or anti-yeast herbal support. Or in more extreme situations, you may need to do something along the lines of a prescription medication, right? But that's relatively rare. And then the last thing here to think about to bring this together is what I call labs to lifestyle, right? So it's not just about the supplements that we're going to recommend. For a stage 1, you want to get the person on the foods that are going to provide the fiber and the polyphenols to get their microbiome back on track. And so that's your beans and berries. Somewhere in the midst of time, beans have kind of fallen off the human radar for diet. And I know that when I go to my local health food store and I buy beans, this happened to me just recently. This very nice young person, I don't know, I'm like 55 years old. So young to me is anyone like in their 20s and 30s, right? It's probably like a 30-year-old. Very nice young person looked at me and was like, what are you buying all these beans for? I'm like, what do you think human beings are supposed to eat? I didn't say that back, but that's what I was thinking. Okay, we got some education to do here for the millennials, okay? Beans are the primary, the most beautiful source of fiber. Why do we need this fiber? Because that's what the bacteria are going to use to grow out. Okay, we're not eating the beans for ourselves, we're eating the beans for the microbiome. Berries have the polyphenols. The blueberries, the cranberries, the pomegranates. Of course, you can get polyphenols in most fruits and vegetables. And you can just Google, if you have a free minute, fiber-rich foods, polyphenol-rich foods, and have a general sense of the dietary recommendations that you would make along with the supplement treatments. And so I'm a strong proponent of using supplements. And for every patient that I have ever treated, I use a lot of supplements. However, I think they're supplemental. I think they're designed to get that person to the next stage quickly where we can start to get more benefit from the lifestyle changes. So I always want to recommend at least one lifestyle change along with supplements. If they're in a stage 2, now we know that their pancreas or gallbladder aren't working really well. Maybe they're not making enough stomach acid. So chewing your food well, preparing a moment before you eat, right? Sitting down, just taking like 3 deep breaths, giving your body a chance to start to get the gastric secretions going, taking 3 or 4 minutes after a meal to just sit there and enjoy your life and pretend that the world is a beautiful place, even though maybe it's not right now. Just relax, basically. Not having tons of liquids before or after meals. All the things that you would think about that'll really help stimulate pancreatic enzyme production, gallbladder production of bile, and stomach acid, right? You just need a minute for your body to figure out what's happening so it can start to make these things. If you're eating a Big Mac while you're driving your car in traffic, the odds on making enough stomach acid and bile and pancreatic enzymes are probably 0, right? And then if they're a stage 3 and you're really going to have to do some killing, then that's where I get into more serious diets. Like you maybe need to be gluten-free or do an SCD diet or elimination diet or something that's going to be a little more rigorous. But always combining the supplements with the labs and the lifestyle. And I find in general, if I tell somebody to eat more polyphenol-rich food and fiber-rich food, they've been hearing that since they were 4 or 5 years old, right? And all of us have heard from our mothers or fathers 1,000, 100 million, gazillion times to eat our broccoli or spinach or eat that fruit instead of the chocolate bar. And so in general, if you just coach a person and say, well, I think you should eat more vegetables and fruit, it just reminds them of bad parenting experiences. And no one ever does it. Everybody knows they're supposed to do that anyways, right? And they wouldn't be seeing you if they were doing it. They need a reason to eat more fruits and vegetables. So having a lab that shows that their microbiome is messed up and then telling them that the solution is to get more polyphenols and more fiber, and then to say, oh, well, what are polyphenols? Well, that's in fruits and vegetables. And what are the fiber? Oh, that's in beans. Now they're like, oh, I have to eat these foods because my doctor told me because my lab is messed up. That's a lot different than just hearing one more time that you need to eat more fruits and vegetables, okay? So there's a method to the madness there that I think can really make a big difference. If you have the lab, you're going to get more leverage for them to make the lifestyle changes. And that's obviously what the whole point of functional medicine is, right? So big question always comes up, what stage are you going to treat first? Well, I think that depends on a lot of different things. Number one, it depends on you. How comfortable are you doing this stuff? Like on your first 3 GI map tests, you might not want to treat Giardia, You might just think, I don't know, how are they going to react to that? I'm a little nervous. Just do a stage 1 treatment. If the person has Giardia, they're going to have a microbiome imbalance. You can always start with the microbiome treatments: fiber, prebiotics, probiotics, polyphenols. So if you're just not sure, you don't want to jump into the deep end of the pool here, then do something that's simple. The ironic part about this is if you talk to the really old doctors, so I've been doing this 28 years, I'm 55 years old now. I've been doing this for 28 years. But there's doctors who have been doing this for like 50 years that I know really well. And the really old timers, they're in their 70s and 80s and they're kind of crotchety and they've been doing this forever. If they see Giardia, they may just shake their heads and go, oh man, microbiome problem, let's just get your diet figured out, give you some fiber and prebiotics and see how things go. So ironically, as people come to the twilight of their career after decades of experience, they often use these really simple treatments like a stage 1 treatment. So it's not a bad thing if you're a beginner to use that, because it's what a lot of the senior doctors would do in the first place. Severity of the patient presentation. If the person's super sick, you may want to jump in and do an anti-microbial killing program just to push things along a little faster. You may not want to. You may think, well, I don't want to make them worse. Maybe I'll just start with a stage 2 program and I'll put them on some enzymes and gallbladder support and leaky gut repair. And again, the really senior doctors often start with these really beginning type treatments because they've been around the block for a long time and they know that you don't just wake up one day and have cryptosporidium and then just get rid of your cryptosporidium one day and be miracle cure. It's a process and you have to get the microbiome and the organs working properly as part of the overall correction. Sensitivity of a patient is another issue. Some patients are ultra sensitive to all supplements. Probably don't want to start with your first patient on a GI map with a really aggressive killing program. If they're super sensitive, start with the easier programs. And then there's time and money issues. Some people can't afford to do, let's say they have all 3 stages and they may not be able to do all 3 programs. So you want to be, sort of tailor it to the time frame and the money issues and the things that are coming from the patient side so that you make a program that's going to work for them. Okay? So with all 3 stages present, you can start with a 1, 2, or 3. And again, the beginning and advanced doctors, ironically, often end up starting in the exact same place. So you can't do this wrong. And if you can start to learn how to identify what these, well, first of all, you test everybody in your practice with a GI test, because that's the fundamental concept that we're supposed to do here. And when my original teacher, Dr. Bill Timmons, literally wouldn't talk to a patient, a new patient, until the GI testing was done. It would be like going to see a regular doctor and they do, a blood chemistry panel, just general yearly screening test, and they don't really want to see you until you've done your lab work. Just like that. It's the entry level test in his practice, and I've carried that on. So you do that testing initially, you figure out what phase they're in, and then you start to work with the patient to calculate, what's going to work the best for them in terms of doing treatments. Okay. So hopefully this will kind of enlighten you a little bit. We have a special offer that we put together for those of you that are interested. And this is a GI masterclass that I designed recently. And it's really trying to get you to that higher level of patient communication skills, more confidence with how to design programs. And we're just giving it away because we are in a good mood today. And so you just go to kalishinstitute.com/GI map. Go through, it's going to look like we're going to charge you a bunch of money, a couple $100 or whatever, but when you get to that last page, it says coupon code, just type in GI map and it will magically become a free class for you, okay? And if you're curious about this as well, then we also have periodic review sessions where we review labs for people that have gone through the GI Masterclass, and we do those every few months so you can get, again, a little more confidence in your clinical skills and training. And that's really what the Kalish Institute is for. We're here to get clinicians up to speed and get your practices going in any way we can. Okay, so I'm going to wrap it up for right now. We'll just open it up and see if there are any questions. Thanks.
Great, thank you so much for that. Yes, we do have a couple of questions. The first question is, if I did a GI map on a client after they spent 3 weeks on an elemental diet, how would that impact the results?
Well, we know from these tests on the microbiome that you can completely change the microbiome within 3 or 4 days of eating differently. So if you have a beautiful microbiome and you eat poor quality food for 3 or 4 days, it'll collapse and fall apart. But the reverse can be true too. You can have a lot of microbiome related problems, and 3 or 4 days of eating vegetables and lean proteins and no junk food will bring back a lot of these organisms. In fact, even sometimes one meal can make a big difference, right, in what organisms are growing out. So it depends, like if you're, whatever diet that person was on right before they did the test, whether it's an elemental diet or a gluten-free diet or sugar-free diet or junk food diet, you have to kind of take that into account, especially with the commensal bacteria, less so with things like Giardia and H. pylori, right? Because H. pylori is not going to come or go probably based on what you did for a few weeks with the diet.
Great, thank you for that answer. We also have another question. How long does it take to treat stage 3 dysbiosis?
So I have, the way I do it, and I teach this in my training program in detail, and it's a little bit maybe in the masterclass on this, is we start off with all these treatments for the first 2 months, first 60 days with lifestyle. We're doing an adrenal panel, an adrenal program. We get the diet figured out, talk to them about stress, exercise, get all that figured out for the first month or two. And then, assuming everything's going pretty well, we get to the killing part, whether it's dysbiosis or a parasite or yeast. And then I generally recommend 2 months of an anti-microbial killing program. But the patient is now spent at least 1 or 2 months doing all the lifestyle changes first. So we're much more likely to be successful. And then stopping after 2 months of the killing program and reassessing. Reassessing may mean retesting, or it may mean just seeing how the person is doing, depending on the progress.
Okay, great. And someone also asked, do you only treat parasites that are in red or any level? And then likewise for yeast and fungi.
Yeah, so there's judgment calls. So think about it, like all these organisms are on a spectrum. So you can have an organism like Blastocystis hominis, or a yeast overgrowth, or any of these dysbiotic bacteria, or even any of the commensal bacteria. And when they're at a certain level, number-wise, right, they can be harmless, And when they go up to a certain other level, that same organism can cause a lot of harm. The crazy part is the reverse can be true too. You could have a commensal organism like Akkermansia and eosinophilia, where at a normal level it's really great, but when it's excessively low, then it's causing problems, right? And so it's very difficult to do a one-to-one here, because any one of these organisms at any one time, depending on if it's low or high, can be good or bad. And so I'm not really answering the question, but let me, I'll try to, so that's like the background that you should keep in the back of your mind. I'm just gonna tell you my personal preference, which is I really love to kill GI bugs. And it's a problem, maybe it's deep-rooted emotional problem from my childhood, I don't know why, but it's really satisfying to kill things, because it does seem like people get better really fast if you go after something and kill it. So in my own practice and the way that I teach, I probably have an over tendency to kill things. If there's any excuse, even a little excuse to go after something, I found overall that people usually get better if you do. So I would personally be erring a little bit more on the aggressive treatment side, but I want to open it up to the idea that that's not necessarily what all doctors do. Some doctors would be, like I said, the generation that's older than me, they're more conservative. Usually they would go, oh, there's a borderline marker there. Let's do the microbiome thing and see how that works, for a few months, or do the GI organ repair stuff and see how that works for a few months.
Okay, great. And the last question is, have you ever used Golden Seal for H. pylori?
I've used Golden Seal a lot. And when the H. pylori programs that I've done, 99% of them have had mastica as like the centerpiece. But then if that's not enough, and oftentimes we can add in other products like Golden Seal or oregano or something else that's going to have a killing effect. And then always also having a very powerful anti-inflammatory component to the program. So it's not just the killing herbs by themselves.
Okay, great. Well, thank you so much, Dr. Kalish, for that informative presentation. We received a lot of good feedback from that. We did get some other questions that we don't have time to answer today, but they have been sent to our education team. If you missed any of this webinar, the full presentation will be up on our website in 1 to 2 days. So thank you so much, Dr. Kalish, and remember that you can access his masterclass for free at kalishinstitute.com/GIMAP. And thank you everyone else for joining us.